Okay, so welcome to section 9. We're slowly getting through this, a couple more to go. Thanks for holding on. We're going to discuss menopause and mental health. There are a lot of mental health concerns that happen around this perimenopause, menopause, midlife transition, and we want to talk to you about some treatment options and some strategies. So when we look at the statistics of mental health, menopause is not just about the physical symptoms. It has a profound impact on mental health and quality of life. Surveys actually show that 45% of women feel that their menopausal symptoms negatively impact their work, their life, their work-life balance, and hot flashes, sleep disturbances, and brain fog can actually really reduce productivity and increase absenteeism. Despite this, 97% of women report that their workplace offers no support. The Menopause Society has done a much better job about putting some information out there in the workplace, and hopefully more workplaces will start navigating what this transition looks like. But a lot of workplaces don't have accommodations, policies, or education around menopause, and this lack of awareness often leaves women to feel struggling in silence and often alone. 23% of women say they feel more isolated during menopause, and this reflects both the internal impact of symptoms, especially anxiety and depression, and the external reality that the stigma and lack of conversation to have discussion around this. Menopause doesn't affect women themselves. It actually affects all their relationships. 38% of partners say they feel helpless when it comes to helping their loved one through this transition. And this really highlights the need for partner and family education. Menopause is very much a social and a health issue, just as much as it's a biological one. So this course and addressing it requires a lot of systematic changes in our healthcare, in our workplaces, and in our homes, really to kind of reduce that stigma and provide support. So again, we're glad you're here. So how does menopause impact our mental health? Especially during this time frame, there's a lot of pent-up feelings of irritability, impatience. It may lead to more extreme externalized expression of rage, mood swings, panic attacks, poor concentration, word recall, memory, all these different things. And that also impacts our work-life balance when all those other parts and pieces are impacted. Some warning signs to really be concerned about is if you're feeling withdrawn, or you're feeling very low over a period of time, or you're maybe noticing some changes in your personality or physical appearances. Are there work absences or changes in your sleep habits, maybe some forgetfulness or social isolations? Those all could be warning signs and maybe a cue that you need help. A lot of perimenopausal patients start off with saying, I do not feel like myself. I don't understand who this person is in the skin that I'm in. And I think that that is just really important things to consider as you navigate this time frame. Dr. Lisa Mosconi, an amazing researcher out of Cornell who has done a lot of research on menopause in the brain. It's really interesting because this thing she quotes in her the Menopause Brain book, but we often associate menopause with our ovaries. But when women say they're having hot flashes, night sweats, insomnia, the memory lapses, depression, anxiety, these symptoms don't just start in the ovaries. They actually start in the brain. You've heard me say in this series that our brain gets starved for estrogen during this midlife transition. So those are a lot of neurologic symptoms that no one even knows about or talks about, and that's why we need a lot more research. We're not used to thinking about them in this way. So I want to clarify, you are not crazy. It's not in your head, but in reality, it actually is in your head because it's a brain chemical where it does start in the brain. So you often hear about this time called puberty in reverse or perimenopause labeled this way. I also like to call it puberty's evil twin because it's a really unpredictable hormone fluctuations that affect mood, energy, and concentration. Hey, do you remember going through this in puberty? Mood swings during perimenopause resemble that PMS or those puberty changes, but they're often more intense and way less predictable. About 4 in 10 women experience mood changes like irritability, low energy, tearfulness, and even difficulty focusing and concentration. But unlike PMS, which actually follows a cycle, perimenopausal mood instability can appear at lots of different times. They may last for weeks or months or years without really a clear pattern. It's a lot of times why I talk about journaling and knowing where your symptoms are happening. And you're going to have some journaling prompts and some things in this course at the end that you can download. But symptoms can range from mild mood shifts to severe irritability, rage, and sadness, and those sometimes interfere with daily functioning and relationships. This is due to hormonal changes, particularly fluctuating estrogen and progesterone, and that can affect the neurotransmitters like serotonin and GABA, and those help to regulate mood and sleep. So it's really important that you understand you are not going crazy. These changes are very biological and they are real, and there are treatments and lifestyle, hopefully, that you have gotten out of this course that can really help you talk to your healthcare provider to really kind of stabilize mood and improve quality of life. We've also given you some non-hormonal options, so you're free to navigate that without tuning into a healthcare provider immediately if that's the direction you want to go. In terms of anxiety, it affects about 1 in 3 menopausal women, and it can contribute to those panic attacks. It's also a lot more common. A more severe form is a panic disorder or panic attacks, and it's that sudden, intense feeling of that just tightness in your chest. And it can really trigger these physical reactions, and it tends to heighten during this time frame. So again, I want you to feel like you're not alone, and a lot of the symptoms you're feeling are very normal during this transition, but there are things you can do to help. Depression is also really common during this time frame. Studies show that there's a prevalence of 20 to 40% of women have symptoms of depression during perimenopause and menopause. It's also a very isolating time, so that leads to that depression and anxiety. Those declining hormone levels really shift our mental health. They act with those neurotransmitters in our brain, and especially if there's a history of trauma and abuse in the history, that is going to heighten that depression and anxiety. Someone that has gone through an experience of trauma, in particular abuse, is also going to have much more difficult perimenopause and menopausal symptoms. So again, I want you to feel like you're being validated and you're being seen and heard. In terms of perimenopausal depression, oftentimes it's some of the worst symptoms that you feel. It has a 16-fold increase in depression in women age 45 to 52, and a 7-fold increase in suicide for women between 40 and 50. Around 20% of women present to their PCP with these depressive symptoms. A lot of times they're thrown on an anti-anxiety or an antidepressant, and though I totally believe in those medications, sometimes even doing something like menopause hormone therapy should often be a discussion that they have with their healthcare provider. So risk factors for this perimenopausal depression is going to be if you have a prior history of depression, trauma, postnatal depression, PMDD, which is premenstrual dysphoric disorder. Sometimes it's going to be a lot worse for you during this time frame. Your sleep disturbances, life stressors, those are all things that can lead to that. And if you're not on menopause hormone therapy, for some, it can make symptoms worse. I'm not saying menopause hormone therapy is for everybody, but every woman deserves a discussion around it. In terms of brain fog, hormones definitely decline and they can impair our ability to concentrate. So a lot of word recall, concentration, heightened symptoms of ADHD tend to happen during this time frame. So again, not alone. This is a very normal process, but oftentimes getting hormones in balance, in particular around brain fog and boosting up your estrogen levels, do tend to make a difference for a lot of people. Perimenopausally, oftentimes I see that progesterone makes a big deal as well too. So why is all of this change happening? Lots of environmental changes, life stressors. A lot of us are in this sandwich generation where we may be taking care of our own kids and taking care of our parents. Other health conditions. Again, I cannot emphasize enough how important sleep is. When there are sleep disturbances, that really impacts these symptoms and our mental health. And then there can be some other associated behaviors, addictive behaviors, ADHD. It tends to heighten during this time frame, and it can also be really debilitating for patients. So we've talked a lot about different treatment options, but birth control pills are certainly an option. They're usually not first line, but if you're already on them and you need contraception, they work great. Hormone therapy, menopause hormone therapy really can enhance the effectiveness of antidepressants, so they use really well synergistically. Testosterone may help during this time. Cognitive behavioral therapy, we've put a couple different resources on here for you. Medication, exercise, journaling, and different types of social activities may help with that as well. So we definitely saw an uptick after the WHI in the prescriptions of antidepressants and anti-anxieties. I think it would be unfair for me to say that anti-anxieties are the be-all end-all, because nobody talks about the osteoporosis risks that exist with taking anti-anxieties. I just actually learned about it not that long ago, and there are risks for bone loss when you use long-term antidepressants, and no one's really talking about it. But synergistically, when you work with them together, SSRIs with or SNRIs with menopause hormone therapy, it can help. But it's not going to help a lot of the menopausal type of hormone deprivation if you use antidepressants alone. They can be really clinically effective, though, for depression, but they shouldn't be offered as a first-line therapy or as your only option. MHT can be really helpful, although it's not currently FDA approved for this indication. Again, I usually will try that as first-line options, but they can work really well together. If you feel like you need help, please try to find a person that will work with you. If symptoms are very severe, seek immediate help. Here's the National Suicide Hotline. And oftentimes you can look at a person and their symptoms are not appearing how they appear. But if you are feeling that there's any risk to hurt yourself or others, immediately get help. All right, so I'll see you up next in the coming bone health and menopause. Thank you for sticking around, and I'll see you in the next module.